colleagues Lucy Arvayo from Jane's Due Process, Camion Connor from Texas Equal Access Fund, and Erica Galindo will also be joining me here today. We are also joined by State Representative Sheryl Cole and State Senator Sarah Eckhardt, the authors of Rosie's Law. Rosie's Law is a groundbreaking piece of Texas legislation designed to restore and expand insurance coverage for both abortion and contraceptive care. This bill would mandate that Medicaid, private insurance, and federal marketplace plans provide comprehensive coverage for all legal abortion care and all FDA-approved contraceptives. It also ensures access to services like sterilization, emergency contraceptive, counseling, and pain management, all without cost sharing or unnecessary restrictions, guaranteeing Texans the full access of reproductive health care. Every Texan deserves equitable access to comprehensive reproductive health care, and Rosie's Law is a crucial step in making that a reality. We are deeply grateful to State Representative Sheryl Cole and State Senator Sarah Eckhardt for their unwavering commitment to reproductive justice. As authors and champions of Rosie's Law, their leadership brings us closer to a Texas where everyone has the freedom to make decisions about their health care and their future. Rosie's Law is named in honor of Rosie Jimenez, a young mother and student from McAllen, Texas, who tragically lost her life in 1977 at the age of 27 due to an unsafe abortion when Medicaid denied coverage for her care. Rosie was part of the community we proudly serve at Frontera Fund. As an abortion fund dedicated to providing financial and practical support for abortion and reproductive health care for Texans living in border communities, Frontera Fund is committed to ensuring that no one else has to endure the barriers that Rosie faced. Every day we serve Texans like Rosie, individuals working tirelessly to make ends meet while navigating immense challenges to access the care they need. The severe abortion bans in Texas have turned accessing care into an arduous and often overwhelming journey. The complex web of restrictions forces many patients to travel long distances, navigate confusing systems, and overcome financial and logistical burdens to access basic health care. Rosie's story is not just a memory of the past. It is a reality we continue to witness today. We see the devastation that abortion bans inflict on individuals and their families. We see how barriers to care can lead to tragic, avoidable loss of life. Rosie's story is a constant reminder of what's at stake and why we must fight relentlessly for a future where everyone has access to safe, compassionate care. That's why Frontera Fund, Lilith Fund, Texas Equal Access Fund, and Jane's Due Process proudly support Rosie's Law as part of the Rosie's Law Coalition. Together, we are working to ensure that no one else has to face these heartbreaking barriers, and we remain steadfast in our commitment to reproductive justice for all Texans. Thank you, and now we will hear from Lucy Arvayo of Jane's Due Process, who will read remarks by H.K. Gray.
Good afternoon. Hi, and thank you to everybody for being here. I am so grateful to stand in power with our community partners and legislative champions. My name is Lucy Arvayo. I use she, her pronouns, and I am the executive director at Jane's Due Process. And I had the immense pleasure to speak on behalf of our youth program coordinator, H.K. Gray, who unfortunately could not be here today. At Jane's Due Process, we are the only abortion fund in the country that focuses only on teens' access to reproductive care, including abortion and birth control. We firmly believe that young people are fully capable of making their own decisions regarding their bodies, sexualities, and lives, and that it is their human right to have access to information about their reproductive health. HK planned to share her story today, which highlights why Rosie's Law is such a crucial piece of legislation for Texas youth, and I am honored for the opportunity to share her story on her behalf. HK writes, in 2017, I was a brand new teen mom and had found myself pregnant again. Months prior, I was unable to get the birth control that both my doctor and I agreed was the best fit for me because I was a de facto orphan who couldn't get written parental consent. I knew I wanted to have an abortion, and I went through a lengthy judicial bypass process with the help of JDP in order to finally be able to consent to my own procedure. After all of that, I didn't even have half of what it cost to have an abortion. The longer the judicial bypass took, the more expensive my procedure became, and by the end of it all, I just didn't have enough money saved to afford an abortion. If it wasn't for JDP and T-Fund coming together to pay for it, I would have been forced to carry that pregnancy to term. This would have drastically reduced the quality of life I was providing for my daughter and brought us under the poverty line all before I reached the age of 18. Medicaid should have covered my birth control and they should have covered my abortion, but instead they left me to figure it out on my own. My story is all too similar to Rosie's. It had been over 30 years since Rosie had tragically lost her life, and Medicaid was still denying abortion coverage. This is an issue that doesn't go away. People will always need access to abortion. Making it more difficult for people to access safe abortion just means that we will see even more people in unsafe situations. Rosie deserves to still be here today, and Rosie's Law will ensure that future generations of Texans will have the ability to have full bodily autonomy regardless of who they have their health insurance with. Thank you again for dedicating your time and power to supporting Rosie's Law and demanding that everyone in Texas have access to health care coverage they need and deserve. I will pass it back over to Zaina.
Thank you, Lucy, and thank you for HK for sharing her story. We will pass it over to State Senator Sarah Eckhardt, who is one of the authors of Rosie's Law.
Thanks so much for having me, and I want everyone to take a look at this beautiful picture here and these amazing roses here. My great-great-grandmother was a Rosa. My great-grandmother was a rose. My own daughter is a rose. Every Texas woman is a rose, and we all deserve to be able to choose whether, when, and with whom we have children. Both Sheryl Cole and I are refiling Rosie's Law because we must take the long game to take back our right to decide whether, when, and with whom we have children. In 1977, Congress banned federal dollars for the funding of abortions through the Hyde Amendment. In 2017, a Texas House bill barred private insurance plans from covering abortion. And in 2021, the Texas legislature banned abortion entirely. Without insurance, an abortion costs over $600, with some complications incurring several thousands of dollars in hospital's fees, a price inaccessible to many Texans, even if they can find a provider for what is the infinitesimally small percentage of abortions that are now still considered legal, even if you can find a provider to do the procedure. When Senate Bill 8 passed in 2021, we knew that it was deadly. Since then, maternal mortality has increased, with 90% of the deaths being preventable because women are being denied medically necessary emergency abortions. We know women are dying, and we know why, even if the Texas Maternal Mortality Review Committee refuses to review the deaths in the first 2 years since the banning of abortion in the state of Texas. We also know that the rate of death is much higher for our Black moms than any other group. This ban also threatens every Texan, men, women, non-binary, by affecting their safety, their mental health, and their financial stability. And this abortion ban perverts the practice of medicine by driving ob-gyns from the state, with almost half of Texas counties already being maternity care deserts, meaning there is no obstetrician gynecologist to contact even if you could afford it, meaning that there is nowhere to give birth even if your health insurance does cover it. Obstetrician gynecologists provide a range of services beyond abortion care, including screening for breast cancer, providing critical vaccinations, and even serving as the primary care provider for new families. So how does Rosie's Law help? Rosie's Law removes a huge financial barrier to reproductive care. Rosie's Law lifts bans on private and Medicaid insurance coverage for multiple reproductive services, including abortion, emergency contraception to prevent unwanted pregnancy, and for vasectomies. It also includes counseling on and provision for pain management related to contraceptives. And this legislation means that when abortion rights are restored, and they will be restored, we will be ready. Thank you so much for your advocacy. We've got the long game, and we've got each other's backs. Here's to the roses.
Thank you so much for your remarks, Senator Eckhardt. And now we will listen to Camion Connor from Texas Equal Access Fund.
Hello, I'm Camion Connor, the Executive Director of the Texas Equal Access Fund, also known as T-Fund. Texas Equal Access Fund offers both financial and emotional support to individuals in North, East, and West Texas who lack the means to access abortion and other reproductive health care. Firmly committed to the principles of reproductive justice, we fiercely advocate for the right to access all reproductive health care options, including abortion, birth control, and parenting support. Today, over 700,000 Texans of reproductive age are enrolled in Medicaid, and more than 3.5 million Texans with private insurance face unnecessary barriers that prevent them from accessing the full spectrum of reproductive health care. These barriers are the result of state and federal laws that deny insurance coverage of abortion and contraceptives, pushing critical care out of reach for those already struggling financially. Rosie's Law represents a crucial step toward Texans having access to comprehensive reproductive health care, including abortion. No one should be denied coverage for abortion or contraceptive care due to their income, insurance type, identity, or where they live. The story of Rosie Jimenez is not just a tragedy of the past. It is a present-day warning about what happens when reproductive health care is stripped away and denied. In 1977, Rosie, a young Chicana mother from McAllen, Texas, lost her life because she could not afford a safe abortion due to Medicaid restrictions. Today, Black women like Candy Miller, Amber Thurman, and Portia Gamizzi continue to bear the lethal consequences of abortion bans and barriers to reproductive health care. Their deaths were preventable and were the consequence of a system that continues to place politics over people's lives. And as you can see, Black women are among the ones in our community who are most impacted by a lack of access to health care. The overturning of Roe v. Wade has exacerbated this crisis, leaving thousands of Texans without local abortion providers and forcing people to navigate financial, geographic, and logistical obstacles just to access essential care. These barriers disproportionately impact communities that are already marginalized, including Black, Indigenous, and other people of color, LGBTQ+ folks, individuals with low incomes, and others who have been denied equitable healthcare access. This is a healthcare crisis that cannot be ignored. Every Texan deserves the right to comprehensive reproductive health care, whether it's annual cancer screenings, birth control, prenatal care, or abortion. Rosie's Law would have provided the safety net Rosie Jimenez needed, preventing her from having to risk her life or face criminalization for seeking basic health care. It would have helped ensure that no one, regardless of their income or background, is forced to choose between their health and their safety. Inaccessible healthcare services put people's lives at risk and force impossible choices between their bodily autonomy, freedom, and the well-being of them and their families. At T-Fund, we serve individuals forced to make these choices and who have limited resources. They are our community members, and they deserve the protection and benefits that Rosie's Law offers. Thank you to Representative Cole and Senator Eckhardt for partnering with T-Fund, Frontera Fund, Lilith Fund, and Jane's Due Process to introduce Rosie's Law, House Bill 1098 and Senate Bill 359, to demand that all Texans have access to comprehensive reproductive health care, including abortion. We stand together in this fight for justice and equity. Thank you.
Thank you, Camion, for your remarks and for the amazing work that y'all do at T-Fund. So now we will hear from Erica Galindo from Lilith Fund.
Hi everyone, thanks for joining us today. My name is Erica Galindo and I'm the Organizing Program Manager at Lilith Fund for Reproductive Equity. For over 20 years, Lilith Fund has supported Texans who need abortions. I'm proud to be here today with so many advocates and allies as Rosie's Law is filed. Thank you, Lucy, for sharing HK Gray's powerful story on their behalf with help from our friends at Jane's Due Process. Thank you, Representative Cole and Senator Eckhardt, for filing this legislation and affirming loud and clear that every person, regardless of income, should be able to access abortion care. Abortion bans like SB 8 are killing us. We are still mourning the deaths of Josela Barnica, Nevaeh Crane, Portia Gumezi, and all those whose names we don't know, and are enraged that Texans are forced to wait until they are on death's door to get life-saving care. Bans on insurance coverage make this dire situation worse, forcing people to pay out of pocket or pushing care out of reach altogether. At Lilith Fund, half of the Texans we hear from have no health insurance, and about 1/3 are not working for pay. For those who are, many make the paltry $7.25 an hour minimum wage. It's highly unlikely that someone on minimum wage could afford to pay for an abortion out of pocket or to travel out of state for care. These bans are unjust, and they attack our dignity, autonomy, and our very lives. Rosie's Law has always been personal for me as an organizer and as a daughter. My own mom grew up blocks away from where Rosie Jimenez died. If circumstances were different, she could have easily been in Rosie's situation. I'm reminded of her and Rosie each time we show up for abortion access and reproductive justice. Bold legislation like Rosie's Law is essential to ensure equity and affordability for abortion care. As attacks on abortion continue, we need more lawmakers like Representative Cole and Senator Eckhardt who truly represent the people they serve and who aren't afraid to take bold action and do what is necessary to defend our lives and freedom. Looking ahead, we're in for a fight these next few years. It will take all of us, every single one of us, to show up, speak out, and make sure our communities are safe. This struggle is not new to Lilith Fund and so many others who've been doing this work for years. We've been fighting for our callers and their access to care for more than 20 years. We know that abortion access not only saves lives, it saves futures. Opening up doors that would have stayed shut, ensuring each of us has the freedom to control our decisions and futures is how we all thrive, and Lilith Fund will keep doing whatever it takes to make it a reality. Thank you for coming out today and showing up for yourselves and your neighbors. Let's get Rosie's Law passed.
Thank you, Erica, for your powerful remarks and for the amazing work that Lilith Fund does. I don't know if anybody knows this, but Lilith Fund is the oldest abortion fund in Texas, and they've been doing amazing work for a very long time, so we applaud their work. While we wait for Representative Cole, we will be taking some time for questions right now, so please feel free if you have any questions about Rosie's Law for any of us. please let us know. Do you want to speak? Yes, go ahead.
This is a question for all, but also mostly for Senator Eckhardt. Under GOP control of the House and Senate, we know that they're vehemently opposed to a law like this. So why propose this legislation? Like, it's all.
It's important as a representative to actually represent your constituency. When we are in a circumstance where leadership is no longer interested in the majority view of average everyday Texans and is no longer responding to the facts on the ground, which are maternity deserts across half of the state of Texas, a dearth of any physician, much less an obstetrician gynecologist, and frankly a physician drain from the state because of these policies. It's important to continue to file legislation that actually addresses the needs and the wants of our population. So whether or not Rosie's Law gets passed this session, next session, the session after, or the session after, we must continue to file bills that the people of Texas need. Rosie's Law is so necessary because full spectrum reproductive health care is not a like to have. It's a must have. It is not a health care procedure that is elective. It is a necessary part of our reproductive health care. And so, heck yeah, we're going to file it, even if the current leadership will not recognize the crisis that Texans, and particularly women, and particularly women of color, are experiencing.
Something to add. Can I add something? I wanted to add also that abortion is legal when medically necessary. And so for those folks enrolled in Medicaid and have private insurance, it would allow abortion to be covered for their medically necessary ones. It also, Rosie's Law is also expanded to include no cost sharing for folks for reproductive health care. So that's your pap smears, your cancer screenings, and also your contraceptive care. So there are a lot of reasons still why even today we should be able to pass Rosie's Law, because it would still support many Texans.
Hello, I'm Representative Sheryl Cole, and I'm pleased to be here again, along with Sarah Eckhardt, and having all of your support in filing this bill. I want to acknowledge this been a heavy time for our community and women's rights, but we have to recognize some of the losses. We're living in a post-Roe world where pregnant people like Portia Nizami, Josela Benarca, and Neva Crane die because they were denied life-saving care. And we're still hurting from an election that only God knows where even more lives will be hanging in the balance. It can be hard to find glimmers of hope in such a bleak landscapes, but communities like this and bills like Rosie's Law are what keep me going. Now, more than ever, we need each other, and we need protections in place, especially for marginalized communities. I'm proud of the Rosie's Law and our efforts to get it passed. Heading into this legislative session, the stakes may be higher, but our vision is unchanged. All Texans, no matter how much money they make, should have access to reproductive health care that they need. Rosie's Law ensures affordable reproductive care for Texas citizens, including those on Medicaid. who are currently denied insurance coverage for abortions and incomplete coverage for contraceptive care. As a legislator, I've seen how anti-abortion restrictions come down hardest on women of color, low-income people, rural Texans, and immigrants. I hear every day from people in my district that they're exhausted, they're scared, they're disempowered by the very legislature that is supposed to empower them. Texas lawmakers have a responsibility to protect people's rights and access to health care. But instead, my anti-abortion colleagues have enacted dozens of medically unnecessary barriers to abortion care, choosing shame and control instead of compassion and care. I'm here to remind us that when they come after our rights, we don't give up, we get loud. Legislation like Rosie's Law is how we take back our power and our futures. As we filed this bill, we put anti-abortion lawmakers on notice that they don't have the people's back, but we do, and we're not going back. Thank you.
Thank you, Representative Cole, for your remarks. That concludes the press event. If you have any more questions, yes. Yeah.
Two other questions. First of all, can you, there are lots of laws proposed that we can go in the other direction of what Rosie's Law wants to do, add more restrictions to abortion. So for the lawmakers and also for the abortion funds, how do you plan to resist that, things that go against your agendas?
Well, it's going to be a fight. I can't deny it. Especially the things that are really egregious, going after the doctors who try to perform the care. I think that is going to get a lot of attention, and I'm hopeful, and we're working on it, to get support for the medical community. And so I think it's just, we really have to inform people across the state what the stakes are, and they really are the lives of our women in our state.
I would also add that there will be at least one bill in the House and two bills in the Senate, and one of them will be mine, for a citizen-led ballot measure right in the state of Texas. When your state leadership has become so disassociated with the needs of the state, a citizen-led ballot measure right is important to right the ship. And so we will be working for the creation of a citizen-led ballot measure right in the state of Texas, so that we can get our rights back, even in the face of legislators who've become so disassociated from the state. So I look forward to working with all the folks up here on that issue, as well as some other issue areas that also have found that the state is blind, deaf, and dumb to our everyday Texan needs. Thanks.
All right, well, thank you so much for showing up here today. If you have any other questions or would like to know more information about Rosie's Law, visit rosieslaw.org. Thank you.